Hi dear friends, I am Dr. Sarabjeet Singh, an orthodontist from the Perfect Smile Dental Clinic, Chandigarh. Today I am going to talk about certain points which you should take care while fabricating a HAWLEY's retainer, and as always advised, one should try to make your own HAWLEY's wire bending. Being an orthodontist, you really worked hard for your case. This appliance has survived the time. It's been more than 100 years. It is still the appliance of choice for giving a retainer, a removable retainer. So it generally contains, as all of us know, if it's a first premolar extraction case, a labial bow, that is a short labial bow, and 2 Adams. And if it is a non-extraction case, we add another clasp in between, which could be a pinhead clasp between first and second premolars. So here I want to focus on certain points which you should consider while fabricating an appliance, especially the Adams. Here we often talk about this magic bend. You see a bend here which is just on insertion of the wire into the palatal area, and there is a space which you see along the palate between the wire and the mucosa. This bend leaves a uniform space, as you can see, whether it is labial bow, whether it is Adams, a space all around, so that the acrylic flows both on top of this wire and below the wire. One common problem, generally we miss this bend and make the wire directly touching the palatal mucosa on the model. So when you remove the appliance, you see that the wire is being exposed on the back side. So by giving this bend, only the wire is now touching at 2 points, one at the end and one from the where this bend starts, that is next to the area. As you can see, this area, it starts from here and then it reaches this point. So there is a uniform space, and and as we know, the Adams should be given at 45 degrees. As you can see, it should be quite nicely inserted into the contact areas. Otherwise, the good occlusion which you have achieved while fabric in your orthodontic treatment gets hampered. So it should nicely adapt to the interdental areas, and then it should adapt to the palatal mucosa. It should be good adaptation. The labial bow should be also well adapted. As you can see, if required, you can give a first order bend at the lateral incisor. It should be in the middle third of a tooth, especially for retainers. If you're giving an active appliance, it could be at the incisal and middle third, and nice U bend, so that if required, you can later activate this appliance. So if you give a good HAWLEY's retainer, nothing can match that, but you have to use certain basic steps and try to make a good appliance. Now next thing which is often asked, how much the wire should extend into the palate. A simple rule could be, if you divide the palate into 3 parts, the mid palatal area and the 2 parts between the mid palatal and the palatal mucosa of the near the tooth, if you put a line there, the wire should generally extend just inside the middle lines between the 2 areas which I just explained. And all the clasps should be always pointing mesially, as you can see, whether it is labial bow, whether it is Adams. The palatal extensions are all in the direction mesially, so that when you fabricate and acrylize this appliance, you have got a curvature on the back that prevents a gag. And if you have these wires extending directly into the palate straight, then your appliance on the back will also be a straight portion. My HAWLEY's appliance is ready, fully acrylized, well polished. As you can see, the margins. And the one thing which I was focusing before about the magic bend, as I said, now the whole wires are enclosed within the acrylic. You don't see any wire extensions except at the 2 ends where the wire is seated. The appliance should be checked on the model. Nice extensions. The cutting from the back is in the shape of C. As I said, it prevents gagging. The extensions of acrylic are perfect. On the molar, you don't find any spaces for the buccal developmental grooves, so the food doesn't go in. The extension on the top at the interiors is above the level of cingulum, so that it acts as a self-retentive for extrusion of teeth if required. You can always add a mild bite plane in the interior region. The appliance should be very well polished. There should not be any roughness, so that gives a very good confidence to the patient. And as I said before, the HAWLEY is the best appliance which is available. We try to give it to all patients. They wear it for a year, full-time wear. Then for 6 months they do it nighttime wear, followed by they do it for alternate nights. So this protocol of mine continues for next 2 years, and whatever results we have achieved will be a very stable result, and we have a long follow-up of around 23 years, and we are very happy with the system.